Hi, this is Dr. Pandey. Welcomes you all to the Health Awareness video program. In our previous video program, we have seen the hyperthyroidism clinical features and symptoms. In today's program, let's have a glimpse of hyperthyroidism diagnosis. The word hyperthyroidism means increased thyroid hormone levels, that is increased T3 and T4 levels. Now, the word hyper means high and the word hypo means low. Where before proceeding further for hyperthyroidism diagnosis, let's have a quick review on the thyroid hormone formation, where the hypothalamus secretes thyrotropin hormone, anterior pituitary secretes thyroid stimulating hormone, and thyroid gland secretes T3 and T4, where T3 is called as triiodothyronine and T4 is called as tetraiodothyronine or thyroxine. Now, to study the hyperthyroidism in primary or secondary, we required list of the investigations which may help us in studying the primary and secondary hyperthyroidism. The list of investigations are such like thyroid function test, which very commonly covers with T3, T4 and TSH. The next investigation is beta HCG, human chorionic gonadotropin, beta HCG, and erythrocyte sedimentation rate, ESR. Then the next is radioactive iodine uptake or ultrasound with Doppler and CT scan, MRI. Now, these are the few list of investigations which may help us in studying of hyperthyroidism. Now, in primary hyperthyroidism, where the commonly seen is the elevated levels of T3 and T4 with the low thyroid stimulating hormone levels, means TSH levels. Now, what can be the cause for primary hyperthyroidism? The causes for the primary hyperthyroidism can be Graves' disease, toxic adenoma or toxic multinodular goiter or thyroiditis. These are the few example causes for primary hyperthyroidism. Now, in Graves' disease, where it's a autoimmune disorder, where it elevates the T3 and T4 levels in the investigation, which easily can be seen through thyroid function test. As we in our earlier video, we already been discussed with the symptoms of hyperthyroidism. Now, in toxic adenoma or toxic multinodular goiter, where there is a goiter or nodules, a single nodule or multiple nodules in the thyroid gland, which can be or may not be palpable as they are stuck deep into the thyroid gland, where it can be identified with the help of radioactive iodine uptake, where because these nodules will absorb a lot of iodine during the investigation, where we can see the black spots in the scan. Now, in few cases where the radioactive iodine uptake investigation cannot be suggested, in such cases seen that they've been advised for ultrasound with Doppler test. In that also we can see this nodules. Now the next is thyroiditis. Thyroiditis is inflammation of thyroid gland. Now that inflammation may be due to our own antibodies acting against the thyroid gland, or due to the viral infection, or any drug induced thyroid inflammation may take place, where due to which the thyroid hormone levels will increase, and that may lead to primary hyperthyroidism. Now the thyroiditis can be seen even, we can check this with the thyroid function test as well as ESR. Now these are the few examples for primary hyperthyroidism diagnosis. Now let's see the secondary hyperthyroidism. In secondary hyperthyroidism, where we can see the elevated levels of T3, T4, T3 and TSH, in some cases TRH also. Then what can be the primary causes for secondary hyperthyroidism? The best example are pituitary adenoma and hypothalamic hamartoma and molar pregnancy and stroma ovary. Now these are the few examples of secondary hyperthyroidism, where in the pituitary adenoma we can have adenoma of pituitary gland, which increase the secretion of thyroid stimulating hormone. When the thyroid stimulating hormone secretion increases, it increases the T3 and T4 secretion also. So we can see increase of TSH, T3 and T4. Now in hypothalamic hamartoma, where the adenoma of hypothalamus, where it increases the secretion of thyrotropin hormone. When the thyrotropin hormone secretion increases, then thyroid stimulating hormone secretion will also increase. That in turn T3 and T4 secretion will also increase. So that can be the cause for secondary hyperthyroidism. In molar pregnancy, where the molar cells looks like a grape shape in the uterus. During this pregnancy, we can see a lot of production in beta HCG. When the beta HCG production is being increased very rapidly, that will stimulate the thyroid gland to increase the secretion of T3 and T4. That can also lead to the secondary hyperthyroidism. Now in the stroma ovary, where there is this is the ovary, where the tumor of ovary which produces the thyroid gland type tissue which secretes the thyroid hormone. Now this ovary which has been produced, the thyroid tissue secretes thyroid hormone. This thyroid hormone secretion will lead to the increase the levels of thyroid hormone levels in the blood. That can lead to secondary hyperthyroidism. So these are the few examples on causes for hyperthyroidism diagnosis. With some more information related to thyroid, we will meet in our next video. Till then, thank you.